ได้ Morning, everyone. We'll be starting in about 10 minutes po. Morning, everyone. We'll start in 5 minutes. Let's wait for other participants. In the meantime, while waiting, please like and follow St. Luke's Medical Center Quezon City official FB page and YouTube channel po. Hi, good morning, everyone. Welcome to this week's lecture series on basic emergency practices. Our topic for today is animal bites. I am Dr. Shane Chug, an emergency medicine resident from St. Luke's Medical Center, Quezon City, and I will be your moderator for this session. Our speaker for today is Dr. Karla Cruz, an emergency medicine consultant from St. Luke's Medical Center, Quezon City, and she will be talking about animal bites, focusing on anti-rabies and anti-tetanus as well as its corresponding treatment. After the lecture, we will be having a short question and answer portion, so feel free to type in your questions in the chat box. Okay, so we'll be starting the lecture now.
A pleasant day to everyone. I'm Dr. Karla Cruz from the Department of Emergency Medicine, and my presentation will be about animal bites. Okay, so bites from animals are actually a very common complaint into the ER, and just a story on the previous year when the pandemic started, while our top one census was COVID-19, the second one is the number two most common case coming into the ER was animal bite. So it was one of the top reasons on why a patient would go out of their houses during a pandemic just to go to the emergency room. The management of animal bites would actually depend on your exposure category. So here we have our three categories of rabies exposure. So the first one would be licking on intact skin or just merely touching or feeding animals. The category 2 is having minor scratches or abrasions without any bleeding. And category 3 is when your wound has already an access to the bloodstream. So if there's presence of bleeding, or if you have multiple bites or a bite from a bat. And category 2 exposures on the head and neck. So how do we manage these animal bites? So first and foremost, most importantly is wound care. So you have to wash immediately the wound with soap and water for 10 to 15 minutes, after which you could apply alcohol, betadine, or any antiseptic. And then proceed immediately to the nearest facility for immediate rabies vaccination. Now, if your exposure is under category 3, you would also need to have rabies immunoglobulin aside from your rabies vaccine. So how do we give the rabies vaccine? If you don't have any previous coverage for rabies, you will need to have the full recommended dose or regimen. So we can have an intradermal or intramuscular regimen. And most commonly, this one in the middle column is what we advise. A one-site injection on day 0, day 3, day 7, and day 14 to 28. Now, if you're already previously immunized and you have completed this regimen previously, you may be given the booster doses on day 0 and day 3. But if you already have completed the regimen within the previous 3 months, there are no boosters required. So in summary, the vaccination schedule for the rabies vaccine is day 0, 3, 7, and 14 to 28 if you don't have any previous vaccine. If within 3 months you are bitten again, then you don't need any boosters after you have completed this one. And after the 3 months, if you are again bitten, you will be given boosters on day 0 and day 3. So the rabies vaccine is ordered as 0.5 ml intramuscularly given in the ER. And for adults, it's given on the deltoid area of the arm, and for children on their thighs. And it is not given on the gluteal area because of the unpredictable absorption of the vaccine. Now, for the category 3 exposures for animal bites, we also need passive immunization through administration of the rabies immunoglobulin. And this is administered only once, as soon as possible, but not to be given beyond day 7 of the first dose of the vaccine, because by then you have already developed some sort of immunity with the vaccination. And if with documented complete rabies vaccine regimen previously, the rig is not indicated unless you're bitten by a bat or you're immunocompromised or if you have deep multiple animal bite wounds. You infiltrate the immunoglobulin as much as possible into the wound with no minimum dose as long as the wound is covered by the infiltration, and the maximum dose will be for human rig, it's 20 international units per kilogram body weight, and for equine rig, it's 40 international units per kilogram body weight with skin testing. Now, based on the guidelines given by the WHO and the PISMID in 2018, the remainder of the vial after infiltration does not need to be injected intramuscularly. So what you need to have is just the amount required for you to infiltrate the wound. Now it's ordered as each rig 1 vial infiltrated into the wound now. And again, the dose is the number of vial to be used depending on the size of the wound. And again, it's given as soon as possible but not beyond 7 days of the first dose of the vaccine. Now, suturing of wounds is not recommended as it may inoculate the virus deeper into the wound. And if it's a gaping wound, it may be coaptated using sterile adhesive strips. And if you really need to do some sort of suturing for coaptation, it should be delayed for at least 2 hours after you have administered rig into the wound. Now, also with any case of skin breaks or wounds, we also recommend anti-tetanus immunization. And if you haven't had any vaccination against tetanus, you will be recommended to undergo both the tetanus toxoid and the human tetanus immunoglobulin. And both of them are given in one dose intramuscularly at the same time as the rabies vaccination. Now, for rabies or animal bite wounds, it is classified as a dirty wound. So, if you don't have any previous coverage, you will be needing both the vaccine and immunoglobulin. But if you already have previous tetanus vaccination, you will be given just the booster for the tetanus toxoid, and not the immunoglobulin. For antibiotic treatment, it's recommended for frankly infected wounds and for category 3 cat bites because the teeth of cat were considered to be more sharp and penetrates deeper. So definitely the patient will need oral antibiotics. And all other category 3 bites that are deep, penetrating, multiple, or extensive, or located on the hand, face, and genital area. And the first line antibiotic for animal bite wounds is coamoxiclav. And here you also have other options of antibiotics that can be given for animal bite patients. Now, this is a list of animals on which you need rabies prophylaxis. So, for domestic animals like dogs, cats, and livestock including cows, pigs, horses, and goats, and wild animals including bats and monkeys, you will be needing rabies prophylaxis. Now, on the other side of the column, for these animals, you will not need rabies post-exposure prophylaxis, and that will include commonly bites from rats, guinea pigs, rabbits, hamsters, snakes, birds, insects, and fish. So what about being bitten by a vaccinated animal or your own pet in your house? That will depend on the category of your exposure. So if it's just category 2, guideline says that you may opt not to undergo vaccination if you fulfill both these categories. So if the pet is healthy and available for observation for 14 days, and if your pet was vaccinated against rabies for the past 2 years. However, if your exposure is category 3 and if you have a bleeding wound, both the rabies vaccine and immunoglobulin is still recommended. Now, if you opt to have pre-exposure prophylaxis or vaccination prior to any incidence of animal bites, you will be given a one-site IM vaccine administration on day 0 and day 7. Now, what happens if you get an animal bite after the COVID-19 vaccine? So, we've had several cases of this when patients come into the ER for rabies vaccination and then they have had their first dose of their COVID vaccine. So, according to the recommendation of the PSNID on their CPG, since rabies is a rapidly fatal disease, you should still immediately receive the rabies vaccine regardless of whether you've just had your COVID-19 vaccine. Now, since the recommended interval of the COVID-19 vaccine from other vaccines is a plus or minus 14 days, the guidelines state that it can still be administered at a shorter interval given that the benefits outweigh the risk. And for both vaccines, their series need not to be restarted and you should just resume doses as recommended or as scheduled. So that is the end of my presentation, and for my take-home message is any bleeding wound from an animal bite, it does require your wound care, wound washing, and then immediate vaccination with rabies from the nearest animal bite center or emergency room. So thank you for listening everyone and have a great day.
Okay, so thank you, Dr. Karla, for the very short, concise, and very informative presentation. We will now proceed with the question and answer portion. So kindly send in your questions sa chat box. We'll try to answer most of them in a limited time. For
Okay,
those
so while
asking,
okay, sure.
for those asking po, the video presentation will be posted on our official FB page and YouTube channel.
So I think we have the first question, Shane.
Okay, so what is your say po, Doc, about using garlic to disinfect animal bite for first aid?
Okay, so our guidelines state that the wound care of a bite wound, the first aid would be washing with water, water and soap. So that's it. You don't need to use garlic or any other stuff. So once you get bitten, you put your wound under running water and then wash it with soap. And then you may proceed to apply an alcohol or betadine or any antiseptic rather than putting garlic because you may introduce more infection or bacteria into the wound. So just plain soap and water will suffice to clean the wound for your first aid.
Okay, next question po, Doc. What if the vaccination series doesn't get completed? Is it okay daw po?
If bitten by a dog, the recommendation or the minimum that you may have is the first and the second dose of the vaccine. That's the minimum that you may have. If you cannot complete it or beyond the second dose, and then you see that the pet is healthy, the pet has no illness, actually the vaccine series may be discontinued, although the protocol is total of 4 doses. If you cannot complete it, the total four, best to have the first 2 doses for your protection.
Um, okay. What is how do you define daw po, Doc, a frankly infected wound?
A frankly infected wound is if you see some redness around the wound, if the wound is swollen, and then you can see some discharge coming out of the wound, and it's very painful for the patient, then it's prudent to say that the wound is infected and may need antibiotic treatment.
Okay. This is a usual question, Doc, for our patients, no? Yun nga po, he was, may nagtanong, Doc, na she was given tetanus toxoid and immunoglobulin first dose, and then na-quarantine kasi siya for 14 days. Hindi daw siya nabigyan ng second dose. Is it okay na after na lang daw po ng quarantine niya?
Protocol states that the rabies vaccine and immunoglobulin should be given as soon as possible. However, if unavoidable na napunta or you're put in quarantine, then you may opt to have the vaccine after your quarantine. No? Although if you are able to observe your pet and then see that wala siya, it doesn't have any symptoms, it's still alive after the observation of 10 to 14 days, then the risk of rabies is less or no chance na. So more likely the dog doesn't have rabies and you don't have rabies infection. That's it.
What is the risk po of, I think, acquiring rabies if the patient did not get an anti-rabies vaccine po or an anti-tetanus vaccine?
And now we cannot really predict that you will not have rabies or you will have rabies after you get bitten. No? That's why the recommendation is any bleeding wound, you have to get your vaccination immediately. What will give us a guide on whether or not the dog or the animal has rabies if the animal has symptoms. And that's why the guideline of observation for 10 to 14 days is there. So if a patient does not have the option of going to the hospital for vaccination, the next option will be to observe the animal. So if the animal remains without symptoms and is alive after the 10 to 14 days, then there is less chance that the animal has rabies. Now, if within the observation period of 10 to 14 days, the animal develops symptoms such as weakness, it's not eating properly, or it's having chills, vomiting, or diarrhea, then you may opt or you must
prioritize getting your own vaccination also.
I think this has been discussed a while ago, Doc, pero i-emphasize lang natin. Is it needed po for anti-rabies if you've been accidentally scratched by your pet, kahit daw po completed na yung vaccine ng pet?
It will depend on your wound, no? If the wound is just superficial or just an abrasion or a scratch, and then you're sure that your pet is fully updated of his vaccination, then you may opt not to get your vaccine. But if you have multiple wounds, lalo na, or more so if the wound is bleeding, then best pa rin for you to get your own vaccination coverage.
Is it mandatory or required for dog or cat owners to have a anti-rabies vaccine?
I'm sorry, for dog or cat carers?
Owner po.
Owners, yes. For you to be at peace, it's not mandatory but per se, but if you want to be protected from, just in case you will have an animal bite wound, and then you may opt to get your vaccination, but it's not mandatory by protocol. Although the rabies vaccination prior to any bite is recommended for those who are round the clock caring for animals. So for veterinarians or for those caring for livestock, then for them, it is best that they have pre-exposure or pre-animal bite wound vaccination. But for those caring at home, the first step, I think, would be to vaccinate your own pets first from the vet.
There's a question po from a person working as a company nurse in a livestock company. Pag daw po nakagat sila ng pig, is it required na magbigay ng anti-rabies?
I think pigs are part of livestock, so it's
Yes,
part
ma'am.
of the protocol that carers for pigs should also have rabies coverage or vaccination. Although it's not very common, it's not a very common complaint into the ER, being bitten by a pig.
Okay. What if pregnant daw po, Doc? Do you still recommend vaccination for pregnant patients?
Yes, both rabies and tetanus vaccinations are safe for pregnant women. So even if you're pregnant, you get bitten, you can still have the vaccine.
For the can the Tdap vaccine daw, Doc, be used as an alternative to tetanus toxoid?
Yes, actually in the pediatric population, the Tdap is used instead of the tetanus toxoid. So yes, it can be used as an alternative.
How long is the effectivity period of anti-rabies and tetanus toxoid daw po, Doc?
So if you complete the recommended series of the rabies vaccine, actually you'll be covered for life. Except for cases that you get bitten again, and then you will need booster shots. You will not be getting the whole 4 doses. So once you complete your 4 doses and then you get bitten again, you will only need 2 doses more, 2 booster doses. For anti-tetanus, I think the coverage is 10 years. So if you have completed the series of 3 injections for tetanus, then you're covered for 10 years. But if you sustain a wound again and the wound is deep, extensive, or highly high risk for infection, then you will be given a booster shot for that.
Okay, there's a question, Doc, regarding inducing bleeding. Some people kasi, Doc, actively induce the bleeding on the wound. Is it okay daw po to do that, Doc?
Actually, there is no recommendation on doing that when you sustain a wound, because you may just introduce further bacteria or you may damage further the wound. So the first care is still, when you sustain the wound, you put it under running water, wash it with soap and water, cover it, apply antiseptics, and then proceed to an emergency room or a clinic for your vaccination. So there's no recommendation on inducing bleeding for the wound.
Wala daw po bang side effect, Doc, yung anti-rabies to all COVID-19 vaccines?
The rabies vaccine is actually relatively very safe and well tolerated. So actually, we seldom see patients who present with side effects after the rabies vaccine. Now, in relation to having that and having the COVID-19 vaccine, there really isn't on interactions of both vaccines. But the recommendations state that if you really need to have both, you can get both. And the side effects of any vaccine, including pain or swelling on the injection site, is still there. So it can be managed supportively.
Okay. For rabies vaccines po, Doc, and you don't remember if you finish the full four doses, is it recommended to get a new 4-dose regimen if you get bitten po again?
Yes, if you haven't completed the 4-dose regimen before, or you have unrecalled number of doses, what we recommend is for you to still complete a new 4-dose regimen so that you'll know that you had the full coverage of the vaccine.
Okay. Regarding booster doses po, kasi may different brands, Doc, no? So is it okay daw po if the booster dose first is, I think the first dose is given is Verorab, and then the second is Spida.
Okay, so ideally, it's nice that you get the same brand for all your vaccines, but if it is unavoidable that you have to get another brand of the vaccine, it's okay. It's okay to have multiple brands. Although best if you have the same brand, but if you cannot avoid it, like you got the first dose on the province and then you went to Metro Manila to get your second dose, then it's okay that you get a different brand. You don't need to restart the whole series or the regimen.
Okay, so medyo common, Doc, yung question, baka hindi nila narinig yung part. Is it okay to suture bite wound po?
Okay, so that will actually depend po on the bite. So if you have bite wounds are already classified as high risk for infection, and for that category alone, we do not recommend total closure or suturing of the wound because it may predispose the wound further to infection dun sa loob, inside. So what we recommend, if it's gaping wound, we can co-update the wound using sterile strips, but not fully close the wound or suture the wound completely.
Okay. Which animal, Doc, are most common to carry rabies?
The most common animals that have rabies by literature are dogs and cats. And the most common animals presenting to the ER with the most common animals that bite patients that come into the ER are dogs and cats as well.
Okay, Doc. Ito wala to sa question box, Doc, but it's a usual question in our ER. Is it okay, Doc, for the anti-rabies or anti-tetanus vaccine to be given earlier or later po, Doc, than the scheduled date?
Usually we recommend if you can get it on the day that you are supposed to get it, then that's the best option. But if it's unavoidable that you present to the ER or to the clinic on the day of your schedule, you may miss it by 1 to 2 days. That's it. But further than that, you may be advised that you have to start again your regimen.
Okay. Due to limited time, I'll be accommodating 5 questions na lang po. So for question 1, if you wake up with a bat in your bedroom, should you assume you have been bitten and received the rabies vaccine?
If it will give you a peace of mind, then yes, you can get your vaccination. Although you may inspect yourself first if you have been bitten. But if you're really very worried, then there is no harm for you to get a rabies coverage or vaccination.
Okay. Second question, if you completed the tetanus toxoid tapos nakagat ka daw po ulit, do you still need to get another tetanus toxoid, Doc?
That will depend on the wound or on the wound. If it's very if it's gaping, deep or extensive, you may be given a booster. But if it's very superficial, then your full dose regimen on the prior visit will suffice already or will protect you. More so if you have been given the tetanus immunoglobulin.
Third question, Doc, how about for human bites? Do you need rabies vaccination?
No, for human bites, what you will need is wound care and then the tetanus vaccination, but not for rabies.
Okay. Second to the last question, Doc, how about rat bites po? Usual complaint din po kasi yung rat bite. Do you need
Yes, also Yes, that's also the third animal that is that bites patients that come to the ER. But for rats, no, you don't need any rabies vaccine. You only need the tetanus vaccine and your wound care.
Doc, paano daw po if may allergy sa medication like last question, Doc, if the patient has allergy to medication like for amoxiclav daw, Doc, how do we give medications po?
Um, for those with allergies to, for example, penicillin, you can still be given the vaccination, but you'll just have to observe you for any allergic symptoms. And the antibiotic for your case will be adjusted accordingly. So you'll be given a different kind of antibiotic than the one that you are allergic to.
Okay, we'd like to answer more questions sana, but we have limited time lang. We would like to thank Dr. Karla Cruz for the presentation and for answering our questions. And we would also like to thank everyone for attending and listening to our lecture for today. For those asking, the lecture will be posted in our official Facebook page and YouTube channel. Please like and subscribe na lang po sa St. Luke's Medical Center FB page and YouTube. We'll still be having another lecture next week and see you then po. Thank you.
Thank you, everyone. Have a nice day.